Hey guys, Dr. Arland Hill here today, and I want to share with you the Hashimoto's disease diet that I use with my patients, and hopefully it'll be useful and insightful for you as well. Now, if you're someone who's dealing with Hashimoto's, you obviously understand the burden of trying to deal with this condition. Hashimoto's, because of its nature as an autoimmune condition, can certainly have fluctuations, and that's significant when we start talking about thyroid function. As we all know, thyroid function is related to the overall metabolic rate of the body. So if we have adequate amounts of thyroid hormone, our metabolism runs at a normal, regular, ideal rate. If we have too little thyroid hormone, our metabolic rate is sluggish. We don't quite feel ourselves. Mentally, we may feel like we're not quite as functional as we need to be. Some may even think about this as being in a brain fog. If you're on the hyper side or at a period of exacerbation with your Hashimoto's disease, then one of the things that can happen is your body can feel wound up. It can feel like it's revved up too much, if you will. So obviously there's some burden with Hashimoto's, and especially considering the fact that it can bounce back and forth given the immune presentation towards the thyroid or towards some of the enzymes related to overall thyroid function at any given time. Now, when we think about Hashimoto's disease, we have to also think about it in a bigger context and realize that what we're dealing with is not per se a thyroid dysfunction, but what we're really up against is an immune system dysfunction. So we really want to look at things that are going to support the immune system, and that's also significant because when we talk about autoimmunity, and not just Hashimoto's disease, but any autoimmune condition, because the immune system is the area of dysfunction and not per se the individual tissue that's being targeted, that simply means that other tissues are more likely to become susceptible as well. So if you have one autoimmune condition, your likelihood of having other autoimmune conditions is greatly increased simply because the immune system is a problem and the immune system can start to become overreactive. So with that said, what kind of things are we going to be thinking about that could cause the immune system to be overreactive? Well, we know with any autoimmune condition, there's a couple of factors that we have to consider. We have to consider, one, your genetic predisposition. We have to consider the health of the gastrointestinal tract. We need to consider environmental triggers, whether those are allergies or sensitivities or different toxins in the environment. We need to consider different hormonal effects. So for example, females are more prone to autoimmune conditions than males are. And we also need to consider the different nutrients in diet that have been shown to have an effect on Hashimoto's disease as well. So with that said, where do we start? Well, one thing I want to point out is that Hashimoto's disease is also linked to celiac disease. Well, celiac disease is probably one of the more common autoimmune conditions. So right off the bat with this, we can begin to see that when we talk about gluten, which is the main concern with celiac disease, that's also one of the main things that we should be pulling out of the diet if you're looking at the best approach for your personal Hashimoto's disease diet. That becomes number one on the list, and there's good association between that condition and or between Hashimoto's disease and gluten. Number two on the list is going to be dairy. Dairy is linked to type 1 diabetes. There's also a correlation between Hashimoto's disease and type 1 diabetes, another autoimmune condition. So right on this list, we're going to put dairy. And when I say dairy here, we're talking about the whole gamut. We're talking about milk, we're talking about cheese, we're talking about yogurt. Anything with a dairy product or casein or whey, those all need to go out of the diet. The last point I want to make with regards to the diet is these are the two that are most correlated. These can be allergies or sensitivities, so we want to pull them out. But really, beyond this, it starts coming down to what are your individual needs. And that really goes back to looking at different tests and not taking a guess beyond this point. Everybody is a little different on this because of the immune system reactivity being a little bit different. The reaction to different foods are going to be, or your reaction to foods are going to be different than say what the next person with Hashimoto's disease might be. So the testing that is really most beneficial in this area is twofold. One, we want to look at overt allergy testing, but we also want to look at what are known as delayed sensitivity or just delayed immune reaction type testing as well. So we want to keep in mind the idea of overall individuality. No two people are the same. We don't want to treat your Hashimoto's disease diet just like anybody else's either. You're a unique individual and you need a unique approach to this. Does the autoimmune paleo diet work? Yes, it probably does, but it's, again, not specific. It does hit the big core areas, and most people, especially because that diet's pulling out grains or gluten and dairy, it's going to have some significant impact for most individuals that try it. So I do definitely recommend that as a starting point. However, if you really want to hone in on what your needs are, you have to go one step further. So personalize your Hashimoto's disease diet. Thanks for listening. I'm Dr. Arland Hill.